So a very warm welcome to all our viewers and welcome to a new edition of Africa Today, our program bringing you all the latest news and events happening all around the African continent. My name is Angie Meher and I'll be joining you this afternoon. And as usual, we'll begin straight away with a look at some of the news making the headlines, and we start with Chad, where Chad's new military council named a civilian politician, namely Albert Pahimi Padzake, as the Prime Minister of the transitional government on Monday, a week after President Idris Deby's battlefield death. Padzake served as the Prime Minister from 2016 to 2018 and was seen as an ally of Deby, who ruled Chad for 30 years. We have more details in the story.
Chad's military named the civilian Prime Minister Albert Pahimi Padzake to head a transitional government on Monday, a week after President Idris Deby's battlefield death, but opposition leaders quickly dismissed the appointment. Padzake served as Prime Minister from 2016 till 2018 and was seen as an ally of Deby. The transition and the wrangling around Chad is being closely watched in a country that is a power in Central Africa and a long-time Western ally against terrorist militants across the Sahel. The military council is headed by Deby's son, Mohamed Idris Deby, and has said it will oversee an 18-month transition to elections. The council is coming under international pressure to hand over power to civilians as soon as possible. The African Union has expressed grave concern about the military takeover, while France and some of Chad's neighbors are purchasing for a civilian military solution. The US State Department said the naming of a civilian prime minister is a positive first step in restoring civilian governance, adding that Washington is continuing to closely monitor the situation. Padzake ran against Deby several times. He came second with 10% of the vote in an election on April 11th. Deby, who took power in a rebellion in 1990, was declared winner with about 79% of the vote just before he was killed. One civil society leader said he was optimistic that Padzake would be open to talks to ease political tensions.
Continuing with our news, the newly appointed United Nations top envoy for South Sudan expressed strong hope for durable peace in the country after the World Organization warned that the country could be slipping again into large-scale conflict as the implementation of the peace process is moving along rather slowly. We have more details in the story.
The UN has warned that the slow implementation of the peace accord in South Sudan is putting the country at risk of a return to large-scale conflict. A new report has recommended that the arms embargo be extended and for new sanctions against those who hinder the implementation of the peace deal. Since its signing 3 years ago, the country has experienced many incidents of violence between supporters of President Salva Kiir and his rival Riek Machar, who under the terms of the agreement was reappointed vice president. The report says that the conflict has prevented the delivery of humanitarian aid, putting the people of South Sudan in urgent need of assistance.
And for more news, the Prime Minister, Dr. Mustafa Madbouly, received on Monday the first dose of the two-shot vaccine against the novel coronavirus as part of a nationwide vaccination drive. This came after a day that President Abdel Fattah el-Sisi also received the first as part of the national campaign to vaccinate citizens against the virus. Madbouly urged citizens to speed up registration to receive the COVID-19 vaccine in the interest of their health and the safety of society amid a nationwide surge in infections. We have more details in this report.
Prime Minister Mustafa Madbouly received on Monday the first shot of the coronavirus vaccine under a nationwide vaccination drive. The cabinet announced the day after President Abdel Fattah el-Sisi was vaccinated. Administering the Chinese Sinopharm and the British-Swedish AstraZeneca vaccines, the country's vaccination campaign was launched in January to vaccinate medical staff at coronavirus isolation and triage hospitals. In March, the government expanded the vaccination rollout to include all medical staffers, the elderly, and those with chronic diseases. Madbouly urged citizens to hurry up with registration to receive the vaccine, especially amid the emergence of new waves of the virus. The country is also seeking to increase the number of vaccination centers nationwide from 201 to 368, including 10 mega centers that can serve large numbers. According to the latest figures released by the Health Ministry last week, a total of 660,000 Egyptians have been vaccinated, and more than 1.5 million people have registered since March for vaccination on the designated website. The country has received a total of 1.5 million doses of both the Chinese and British-Swedish vaccines. The country has received a total of 1.5 million doses of both Chinese and British-Swedish vaccines. In Sunday's statement, the Prime Minister said President Sisi has ordered arranging the necessary financial allocations to provide the required quantities of the vaccines. Egypt is eyeing new deliveries of both used vaccines and seeking to locally manufacture 2 other Chinese vaccines in order to boost its supply of vaccines. Egypt is witnessing a steady increase of coronavirus infections due to a third wave of the pandemic, with over 900 infections and 51 deaths reported over the past 24 hours. Egypt is witnessing a steady increase of coronavirus infections due to a third wave of the pandemic, with over 900 infections and 51 deaths reported over the past 24 hours.
And we're now delighted to be joined over the telephone by our guest for this afternoon, Dr. Tariq Ibrahim, Professor of Surgery. It's a very good afternoon to you, Doctor.
Good afternoon.
Thank you so much for joining us, Doctor. Now, we've seen very recently President Abdel Fattah el-Sisi as well as the Prime Minister, Dr. Mustafa Madbouli, both being vaccinated in a bid to urge citizens to follow suit and register for the vaccination. Let me start by asking you, Doctor, why do you see that there is some sort of hesitance for people to register and go get vaccinated?
Because there is a lot of talks about the vaccines and the side effects and so on. And I think the President and the Prime Minister to get vaccinated, this is to give example to the people that it's safe and you have to do it.
Yes.
Because if you think about the vaccination, it's much safer to have the vaccine and instead of waiting to get the disease itself. So I think we should go more for the media to explain more to the people what is the vaccination, what is the side effects, what is expected, what is not expected, and the benefit of the vaccine, which really can improve the situation much, much better.
Right. Doctor, now, even with news of certain side effects from some of the vaccinations, there isn't enough clarity with regards to numbers. I mean, at the end of the day, these cases are out of millions of people that were vaccinated. Is that correct?
Yes, but this is a few number of complications.
Yes.
But I think the problem are the people depending more on what they hear or what they listen from their neighbor, from relatives, from other doctors, from the YouTube. I think the government should give all the numbers, all the data regarding the vaccination, all the side effects, so it can be very clear to the people.
Yes,
I think it's lack of information more to the people than something else.
So let's talk a bit medically speaking, Doctor. What are some of the side effects that a person can expect after they receive a vaccination, which are within the norm? Everyone can expect them.
As a vaccination in general, you have some side effects of the injection, some induration, pain, and so on. Some general situation like you feel tired, you malaise, you have ability to eat, a slight fever, bone ache, and so on. This is normal, can happen with any vaccination.
Right.
Definitely, the big problem is what they said about some vaccinations, you can have blood clotting and the vessels. I think people should be guarding against this by taking a lot of fluid. Some can take a slight to prevent the coagulation. And maybe people who are suffering from this coagulation, they have a problem in their coagulation system.
To start off,
they have a problem.
Yes.
I think this should be studied because not everyone got the vaccination, got thrombosis. It means that the problem of the vaccine. It could be a problem of the coincidence or the problem in the person himself.
Right, indeed. Doctor, let's clarify a few more issues related to the vaccination because, as you said, people rely on hearsay and social media, and many of the times this is not scientific. So let me ask you, Doctor, when someone gets vaccinated, they are exposed to a weaker or dead version of the virus. Is that correct?
Yes.
So when this happens, are they contagious?
No.
No.
But they are contagious if they got infected and they are vaccinated, okay?
Okay.
If you
So
are
if they
vaccinated,
get
okay, you get immunity.
Yes.
But some people, they got infected. You cannot see the effect of the disease, but they are carrier for the
yes.
virus.
But that's only if they get infected, but it's not
Yes.
because of the vaccine. Is that correct?
No, no,
Right.
no.
And should they, people say after the vaccine, in the 2-week window, you should lay low and try not to, interact with a lot of people to prevent an infection. Is that correct?
No.
All right. Very
I think
good.
people vaccinated, they can go through the community, but they be careful not to get infected. They have to wear masks, they have to go social distance, they avoid crowdness, the usual. People, vaccinated people, they should be also taking care of
The
themselves.
precautionary measures, yes,
Yes.
yes. Right, Dr. Torre, let's talk a bit about the issue of immunity, global immunity. When would this happen, if how many people or how much of the population receives the vaccine?
The global immunity, I think you need at least or around 2/3 of the population.
Right,
But,
2/3 of the
global-
population.
Yeah, completely, 2/3. But nowadays you have a mass transportation, you have trading everywhere. I mean,
Yes.
in the past when they have some endemic or pandemic, it was localized in the area.
Yes.
But nowadays the communication is very easy. Somebody take a plane from India to America.
Yes.
So I think the problem of the COVID should be taken globally, more than country by country.
Right. Now, of course, Egypt is experiencing a spike in infections. How do you see the COVID situation in Egypt at the moment, according to your opinion, and what is the best way to deal with this spike, Doctor?
Well, definitely, these days we have a kind of a rise in the
Yes.
in the number of cases. So I think people should, people they should take care of themselves. They should avoid crowdness. At least the people, they should do their homework. Avoid to be in a crowded area.
Yes.
Avoid gathering. Avoid going in a narrow places and so on. They wear their mask. They wash their hands. This is our homework. Okay, plus the homework of the government and the Ministry of Health.
Yes. Doctor, according to the Ministry of Health, 660,000 citizens have already been vaccinated and 1.5 million have registered online. How do you see these figures and how much bigger do they need to be in your opinion?
It's a good figure, but we need more. We need people to be encouraged to register their names for the vaccination. Plus, we need more vaccine. But I think they're doing their best. But still, people are reluctant about the vaccine. You
Yes.
understand? This is, I think, the main issue. The media, the Ministry of Health should make everything very clear to the people, the importance of the vaccine and what we need and our plan for so and so to control this COVID problem and so on.
Right. Dr. Torre, now, after the holy month of Ramadan, we're expecting this curve, hopefully, to flatten. Do you see this as a realistic expectation?
Yes, I think so.
Why so, Doctor? What will change?
I think there's good things. I think school going to stop in a few days or few weeks, and then definitely after Ramadan they will know the gathering and so on. The system of life will be in a different way. I think, I hope after Ramadan things will be better.
Indeed, God willing. Right, Doctor, we've seen the Minister of Health in a press conference speaking about the possibility in the very near future of the manufacture of the vaccination here in Egypt to cater for, of course, Egyptians as well as our African brothers, etc. How important is this technology transfer from countries like China, for example, when we are supposed to start manufacturing their vaccination?
Definitely, this is a very good step to manufacture the vaccine here in Egypt. We are more than 100 million people. We need it. Yeah, and I think Egypt is very successful in doing a lot of vaccination before. A lot of the vaccination we are using in Egypt are manufactured in Egypt. So this is what we really need now. It's a step on the way to control this COVID. Yeah.
Yes, indeed. And when vaccinations are produced in a different country from their origin, what is the process that they go through in terms of testing and trials before they're released?
No, I think they don't need trial because they need to do it in the proper way, you know, exactly the same. You don't need to make more trial because you already tried in another country, you know. And already you tried here in Egypt what was done in a different country.
Yes.
This 660,000 people vaccinated. They are properly vaccinated, and the vaccine came from Europe. Okay, it's finished. The trial is finished. You just manufacture and go on. Yeah.
Right. So, Doctor, let's talk a bit about internationally. Why do you see coronavirus infection spiking in many different countries, even though the circumstances are different? For example, we have India, which is really struggling now with their infection rates. What has changed? Is this wave extremely contagious, as it has been advertised to be?
No, but you know, the problem with this virus is the mutation and the changes of the virus, which this can affect the spreading and the slowdown of the spread and so on.
Yes.
So it's really, it's something belongs to the virus, plus the social habits and the situation of the country. Yeah.
And do you still see that prevention is better than treatment, Doctor?
Definitely prevention. In any kind of a disease.
Not just corona.
Prevention, any kind. Corona, infection of the liver, anything in the world. Prevention is the first line. You prevent, take care, and then you do one vaccine, and then treat. Yeah? Yeah.
Yes, right. I'd like to thank you very, very much, Dr. Tariq Ibrahim, Professor of Surgery. Thank you so much, sir, for joining us. Thank you so much for your insight on today's edition of Africa Today. And that's all the time we have for today. We do hope you have enjoyed it. You're in the company of myself, Angie Meher. Many thanks for watching.